Great, so you can see that I've put some cream on Unlee's skin. We use the CR7 from Matriskin. It basically is indicated for post-procedural treatments. It is very much going to soothe, hydrate, and calm the skin. It's got a antiseptic, antibacterial, and then an occlusive function without obviously causing blockages. It's very rich in ceramides and speeds up recovery. So the more you can put on, the better. Next, I'm going to just show you how much we can needle the area with some broken capillaries under the eye and upper cheek. Again, make sure that you have a comfortable grip on your pen. There's some silicone here at the bottom which provides an anti-slip function, so make sure that you can hold it nice and comfortably. Again, just to switch it on, we hold it in for a couple of seconds. Check your needling setting or your pen depth, your needle depth. Again, I like to work just over the 1. You can go all the way up to 2.5, even 3. I do find that the 3 is more indicated for severe scarring and stretch marks. The 2.5 I actually needle very nicely with for the aggressive raised scars. I find that I needle most often up till about 2.0 on the face. So as I said, I go back here just because it's Unlee's first needling session. And adjusting the speed. There we go. Again, wet gauze, wiping away the topical anesthetic. Please note, I'm not wiping away everything. There's still a small or a fine layer of anesthetic left. That is just to provide me with extra slip. So we're going to start by supporting the skin. Let's just go a little bit closer here. So in an area like this, where you can see there's lots of blood, little vessels, you can actually do the punching technique. This is a little bit more uncomfortable for your patient. Also in an area that's difficult to needle, if you find it to be difficult, I do punching on the chin and often on the point of the nose as well, just because it's a more difficult area to get a smooth needling done. So you can needle over it like you would, up and down, sideways. But again, I really like to add the punch because I think that it does create more of a traumatic experience in that area. And remember, needling is all about healing the skin from within, strengthening the capillaries that you have just injured. Again. So we want lovely blood spotting here because this is now the area of concern. I'm going to do a little bit more. You can do it in a row, just for you to know where you've been and where you haven't been. And you can go up and down. Do not hover or treat a small area over and over and over without wiping the area to see how the skin is doing. Alright, so I think that's good for today. Next, I'd like to go onto the nose. Okay, so with the nose, you obviously need a little bit of different support here because it's a little bit more tricky. So I tend to wipe it off with the anesthetic. And I clean this area just next to the nose as well. Then I ask my patient to please take a breath through her mouth, because I'm going to close the nose like that. Okay, Annie, you're
Yes.
fine with that?
Thank you.
So just a dry gauze again to not slip. So I push the one nostril closed with the gauze, and I basically hold it like that so that I can really needle in there, because this is where all of us have bigger pores. Okay. Okay, so now I go a little bit one up, and my setting, I go just a little bit lower, not by much really. There we go. You really need to start playing with your needle and pen, because each skin is different, and you might find that it's more difficult to needle certain areas than others. Also, the thickness of the skin depends a lot on the setting of the needle depth. So as you can see, that's sufficient needling, so I don't need to adjust my needle. That's what we want. You might not get this with a setting of 1.75 on a skin that's very thick. You might also get this type of bleeding with a 0.75 on a skin that's very thin. So I can give you guidelines on how to use this system better, but to be honest, needle depth and oscillation speed really depends on the patient's skin. Also, keep in mind that when patients wear glasses, this area here can really flare up very quickly when you do a needling treatment there. So take special care in noticing that area. You can see there's nice broken capillaries over there, so we're going to really go in there again. That's good. That's what we want. Alright, so with the top of the nose, so the sides are done, as you can see. With the top of the nose, it's a little bit more tricky. So I take a little bit of anesthetic just for my slip again. And then I just go like this. Again, supporting here. And just literally almost flicking it out. I wouldn't say flicking like that, but flicking it out. Oops, sorry. And then obviously I do some punches here. This area gets covered when you do the eye, as you can see on this side. So there's very little for me to go in there with. Again, you can needle very, very close to the eye area. And then some patients have a lot of broken capillaries and larger vessels on the tip of the nose. See, you can see Anli wears glasses. So there's a little bit of bruising almost underneath that area. So the tip of the nose, I do some punches again. Very nice. This is a very easy and successful way to get needling done in places that's a little bit more difficult. Well done, Anli. Okay, so we're going to start or almost end off by going onto the lip area. Again, so now I ask my patient basically to bite her top lip, like that. Thank you. That's great. We remove the topical anesthetic. And we start by needling. Very easy. You can go over the vermilion border. This is often where your lipstick tends to bleed into, and older ladies love it if you can treat that. Good. And then I ask her to open her mouth. Open your mouth for me. Also, you get some lines forming over here, so you want to make sure that you get that treated as well. Again, you can go sideways, following the lip line, like that. Almost like a V. And then you can see that area has not been treated. So you need to open up again for me, support properly, and needle up and down in that little area there. Great. So that's how we do that. You can see this side of the lip is done nicely. This is the side I'm showing you, obviously. When you're also looking at your nasolabial fold, make sure to actually over needle that almost, so that you can see that this line is standing out from the rest of the face, that you've really needled this area nicely. Good. Okay, so now we're just going to finish off. As you can see, I keep on wiping down and cleaning my unit. Next, we're going to just focus on this area, as I believe that that might be a difficult area to do. So we're just removing the topical anesthetic again. Move your patient's face around as you need to have a better angle. So we're going to do that. Supporting again, like that. I really lift the skin when I support. Luckily, you don't have to go over and over and over. As you can see, you get blood spotting relatively quickly with this unit. That's great. I'm going to be just showing you how to, with this area here, I often ask my patient to push their chin forward. There we go, so that we can needle in there. Anli doesn't have that groove, but a lot of patients do. And again, we're going to go nice and close to that lip area. Again, I use small but precise angles. Sorry, we're overlapping there a little bit. There we go. So as you can see, that's nice and close to the lip line. Now with the chin, you can either needle like this. See how I'm supporting the skin? My finger is gliding so that it's a straight surface for me to needle over. So you can either, like I said, do this, or add the supporting fingers, one bottom, one top. And then again, we can add some punching. Make sure you can see what you're doing. There's a little scar over there. Good. Do your row again. Oh, sorry. This is a little bit more tender for the patient. But I think that's it. I'm going to just finish off here. But I think that's good for today. Obviously doing the neck is very easy. Lift up your chin for me as much as you can. Turn the patient to the side, remove the area and support properly. Look how I'm lifting that skin up to give me that smooth. This is very quick and very easy, as you can see. You would just carry on needling the neck until you have your blood spotting. I tend to also separate this in 3 different angles or 3 different areas. 1, 2, lift up for me, 2 and 3. We want to needle this area specifically, so I needle that area across, supporting on this side. As you can see. And then this area here I do last followed by just coloring in this area here. Alright, that's that for today. This is very simple, it's just up and down, but again you need to make sure that your support is proper. As you can see, I've done more than enough needling on those sides because we've got lovely bleeding there. Great, I'm just going to finish off the needling for Anli, and then we will be applying the CR7 again for her, and she'll be using that at home for the next 2 to 3 days. And that's a wrap. Thank you guys.